Are you confused on what to use when you have a discharge? Stay tuned. Hi everyone, make sure you click the subscribe button and let's begin. So I want to show the equivalence here. We have two products, they're both Schedule 1. Okay, this is a Glenmark clotrimazole 1. It's a single dose vaginal tablet, while this is a 6 tablet with applicator. So the difference here already is the milligram. Clotrimazole 500 is a once-off dose, and clotrimazole 100 is to be used 6 nights, 6 times on a longer duration. While here with Canesten we have the cream. It's a single dose pre-filled applicator, and then we have the tablet, which is a single dose tablet. All these are basically equivalent. Sorry, this is the Canesten 1 tablet single dose 500. So these two are basically equivalent. The difference is just in the application. Some people might prefer a tablet, some people might prefer a cream. I would say in terms of dosage accuracy, tablets are more safe if you're afraid of not squeezing in the full amount or losing some dosage. Tablets are already pre-dosed, so that makes it easier. In terms of single dose or 6 days, this again depends on the extent of the infection or the affection or inflammation. If it's a new infection, you may get away with a single dose. So if you catch it early, you may be able to eradicate it immediately. But if it's a little bit more standing or recurrent, then it might be better to use the 6 days so that it really covers for a longer period and has its effect intensely. The downfall with the single dose is that if it doesn't catch all of the pathogens at once, some may be stubborn if they were lingering or for whatever other reason, then they may carry on after the single dose. So it's also very important to always check with your pharmacist or the tech or the assistant that's helping you to really note the onset. How long has this problem been? If it's been a few hours, you can go with a once off. But if it has been a few days or weeks or even months, you will definitely need a stronger, longer-term treatment, plus maybe some oral tablets depending on if you get a referral and if you need to see your prescriber. Then in terms of creams, we have the A-Pore Vaginal Cream. This is also a Schedule 1. And I just want to note that so far we've only looked at Schedule 1s. All of the previous tablets were all Schedule 1s. So these are all Schedule 1 so far. There's also Candizole Cream, Schedule 1. There's Candispore, also Schedule 1. So all these Canex Schedule 1. All these creams are equivalent and need to be used for at least 5 days, 5 to 7. So I would say 7 if it's like a long-ish standing issue for like a few days or a week. But now let's look at Schedule 2s, which are slightly stronger and have slightly more implications. And now this is a Schedule 2, Metrogel, metronidazole, 0.75%. So what does this actually mean? It means that Metrogel is slightly stronger and may deal with deeper issues. Okay, so now we come to the issue between what is the difference between vaginitis or vaginosis and candidiasis, normally called thrush. So between vaginitis or vaginosis and candidiasis, we now need to know which is kind of for which, right? They both have a discharge. The candidiasis can be whitish, it can be creamyish. With the vaginitis or vaginosis, it can be also whitish or off-white or even grayish or sometimes yellowish greenish. You can have itchiness with both. You can have discomfort when you urinate with both. But the telling sign, and listen well, the telling sign between the two will be smell. Candidiasis does not have any smell, but vaginosis may. So if you have some fishy smell down there, it is definitely not thrush, and then you need to use the Metrogel as suggested earlier. This will be ideal for infection of the vagina. But if it's thrush, you're welcome to use Canex V or Candizole, which are clotrimisols. Become more knowledgeable about all the medications you use. So in the end, what does it boil down to? Metrogel should mostly be used for vaginosis and clotrimazole, which is Canex V or all the others, can be used for candidiasis or thrush. I hope this was helpful to somebody. Comment below what you think, if you've used any of these, and let me know. Oh, I forgot to mention, some people also get vaginitis from using fragrance soaps, or from going swimming in public pools, or even from using antibiotics, which cause secondary infections like thrush. So always be mindful to explain how and when it started exactly, so that the pharmacist or the assistant or the tech who's helping you can identify the cause and direct you more knowledgeably. Okay, that's it. Thanks for watching. If you enjoyed the video, put a big thumbs up and follow Farmers on Instagram and Facebook. See you later.